Hello and welcome to this episode of Premier Pain Talk. I'm your host, Dr. Michael Danko. Today we're going to have a brief discussion about what to expect when you come to a pain management clinic for your new patient appointment. I think that anytime you're going to see a new medical provider, there's a lot of anxiety and stress leading up to that appointment because you really don't know what to expect. So I thought this would be a great opportunity to take a few minutes today and give a brief overview of what it's like for a new patient appointment here at Premier Pain Treatment Institute. So generally, when you go into a specialty clinic like we have, the first thing is going to be getting a referral from your referring provider, whether that's your primary care doctor, whether that's a chiropractor or a physical therapist, if that's a surgeon, if you have a workers' comp injury, or if you're being referred from the VA clinic. Different routes of coming to our clinic, but generally we need a referral to be seen at the clinic. And then when that referral is received by our new patient scheduler, she'll be calling to discuss your treatment options and seeing what locations you want to go to. So generally, we'll get patients in within 2 weeks or sooner. If you don't need to be seen that quickly, we can space it around whenever you need to come in. We do get insurance verification prior to your first appointment, and we do our very best to make sure that your medical care at Premier Pain Treatment Institute is going to be covered by your insurance carrier. Now, nothing is 100% in that regard, but we do our very best to verify benefits. And then we have 3 office locations in the northern and eastern Cincinnati. So we have Loveland, Ohio, we have Mount Orab, Ohio, and we have Hillsborough, Ohio. So any of those locations that work well for you, we offer those appointments and we get you scheduled. The first time you come into the clinic, we ask that you come about 30 minutes early. Point of showing up early is that we have a packet of paperwork that you need to fill out as a new patient. So make sure you bring your photo ID, make sure you bring your insurance card, and then if you have any recent imaging discs or CDs or any previous records from other clinics, that information can be given to the staff when you get here, and your provider will review it at the time of your appointment. But it takes a few minutes to go through that packet. We have a consent for treatment. We have privacy releases and records request forms and some other things that are necessary to make sure that we can do the very best in taking care of you. And we need that a little bit of time prior to your appointment time to get that done. So we ask you to come in 30 minutes early, and that way hopefully you're ready in time for your appointment to be seen. Now, this is a clinic for pain management where we do medication management as well as interventional procedures. And if you're intending for us to take over medication management for you, we do require urine drug screen testing as part of our screening process. If you are coming to our clinic for interventional therapies only, whether that's injection therapies or whether that's surgical options, and not planning to require any medication management, then that drug screen can be bypassed. But it is important that if you're expecting medication management, then you should be prepared to provide a sample at the time. So try to drink a little bit of water before you come in. Don't go to the bathroom right before leaving your house. Some of the things that just make it a little bit easier when you get here. Once some of the preliminary testing is done, and you'll be taken to the room by one of our office staff, and our medical assistant will take your vital signs and have those ready for your provider. And then when the provider is ready for you, the first thing that we do when talking to you is really try to get a comprehensive history of your pain condition. So we're going to be focusing mainly on what's bringing you to pain management, which is your pain. So some of your other medical problems that you have, if they're relevant to your treatment here at our clinic, we'll definitely ask about them. But we're going to be diving deeper into what's causing your pain and what's causing some of your difficulty with functioning. That may be going into an injury history that you may have sustained that started this, or may involve discussing treatment you've had at other medical providers, as we try to really frame a context around how you got to where you are today, and that really helps us understand your symptoms and what your best treatment options are. Then we'll conduct a physical examination that's really targeted towards your painful condition. So we'll be trying to narrow down the symptoms and trying to correlate it with physical exam findings. So when you come to pain management, for instance, if you have low back pain, We look at this very differently than if a primary care provider or another specialist is seeing you for back pain. So your primary care doctor, back pain, they may be non-specific. They really may not dive into the actual cause, but in interventional pain management, it's really important for us to figure out exactly what's causing that pain so we can really target a therapy that's going to work the very best for you. And combining your symptoms with those physical exam findings are really crucial. And that really leads us to the next step, which is reviewing any imaging that you have available and trying to correlate all three of those to really narrow down exactly what's causing your symptoms. So again, as I mentioned a few seconds ago, if you have previous imaging, MRI scans, X-rays, CAT scans, et cetera, that are on a CD, you can bring that to your appointment and I can review those prior to seeing you, and that is really helpful with correlating. Now, if you don't have recent imaging or if you don't have access to those, then we can do the things that we need to do to get that established, whether that's ordering new imaging, whether that's requesting previous records. There's ways around that, but it just helps a lot and speeds the process up if you do have those images available to bring into your appointment. And then once we've really narrowed down what is causing your pain, then it's looking at what's been done previously and what we think the next appropriate step is, and that's really a discussion of your plan of care. That's discussion, what treatment options you have. Often that starts with some basic interventional options, and then we do have several minimally invasive surgical treatments that you have. Now, if you really do need to go for physical therapy or other conservative care initially, we'll get that initiated. If you really are at the point where you need a definitive surgery, or you need to go to the orthopedic surgeon or the neurosurgeon for some kind of treatment, we will recommend that as well. But we really try to see where you are on the continuum of care and really help you identify what your next options are, because very often there's more than one way to treat a problem, and often you do have options. It's very rare that there's only one route to go. So we do our best to develop a comprehensive care plan, and then we execute it. This was a quick overview of what it's like for a new patient appointment at Premier Pain Treatment Institute. Again, we have 3 locations in Cincinnati area, and Loveland, Ohio, Mount Orb, Ohio, and Hillsborough, Ohio. Office number is 513-454-7246. You can also go to premierpaintreatment.com and we can look at our locations on there. You can also read about a lot of different treatment options we have. We have an education page that has all of our previous webinars we've done. You'd also go and listen to a lot of my previous podcast episodes to get an idea of what kind of treatment options you have. Thank you for listening, and look forward to seeing you at a new patient appointment coming up soon.